Hi, I'm Hannah Norton, a Reference and Liaison Librarian at the University of Florida Health Science Center Libraries. This video is the second in a four-part series that addresses formulating a clinical question and developing tactics for an optimized literature search. As part 2 of our series, we will be talking about controlled vocabularies. The first question to answer is, what is a controlled vocabulary? Even if the term controlled vocabulary is new to you, you may have heard of some of its alternate names, including subject headings, tags, or thesaurus terms. A controlled vocabulary offers a consistent way to refer to a concept in situations where different authors may have used multiple terms to describe the same concept. To avoid this confusion, a controlled vocabulary is a set of established terms where every term represents a single concept and only one term is used for that concept. Indexers are the ones who create controlled vocabularies and assign controlled vocabulary terms to new articles. Depending on the database, indexers may be required to have a degree in the field, so biomedical databases hire indexers with a background in biological and health sciences. Indexers read through the articles in a database and assign controlled vocabulary terms to new articles and create new controlled vocabulary terms as needed. Some databases use a computer to scan articles for key terms, but a human indexer will always double-check and confirm the controlled vocabulary terms selected for that article. So why do we use controlled vocabularies? The main reason we use controlled vocabularies is that one term from a controlled vocabulary represents all the different terms that authors may have used to talk about that concept. So in this example, if you were running a search on heart attacks, you could use the term myocardial infarction from your controlled vocabulary to represent all the different words, from cardiovascular stroke to heart attack, and their plurals. Controlled vocabularies are also important for distinguishing between words that sound the same but mean different things. For example, the word nursing can refer to the nursing profession, or it can refer to a mother breastfeeding a child. Typing in a search with the word nursing may retrieve search results with both those meanings, unless you specify which term you need using a controlled vocabulary. Controlled vocabularies can also be used to make sure that the database searches the right term for your search. For example, if you are running a search on transient ischemic attacks and typed TIA in the search bar, the database would search for the phrase TIA and wouldn't necessarily understand that you only wanted TIA in reference to transient ischemic attacks. Here, a search for TIA also includes a protein and an amino acid sequence. Controlled vocabularies are also useful for finding terms related to your term. If you're running a search on diabetes, you can find the controlled vocabularies term diabetes mellitus. You can see search terms that might help narrow your search, like gestational diabetes, for a search about diabetes caused by pregnancy, or terms that expand your search, if you're looking for a comparison of glucose metabolism disorders, including diabetes. A hierarchy or tree of terms shows how different controlled vocabulary terms can be broader or narrower than your selected term. So how can I clarify my search using controlled vocabulary? First, we're going to think back to the scenario we were faced with in Finding the Evidence Part 1, and then look at the research question we parsed out of that scenario. In pregnant breast cancer patients, does chemotherapy compare favorably to surgery with radiation therapy in improving health outcomes for mother and baby? We broke that down into our 4 main PICO topics, and now we need to find some controlled vocabulary terms that will help us express those topics. For the patient part of PICO, let's look at the term breast cancer. In our chosen controlled vocabulary example, breast cancer is represented by the term breast neoplasms. Controlled vocabulary can help you tell the database which terms are most important to your search. If you search for your term in the controlled vocabulary, there may be an option to make that term a major topic. By clicking that option, the articles that appear in your search results will feature this term as the key point of the article, not just an offhand mention. If you search for a term through the controlled vocabulary database, you may also have the option to select subheadings for that subject. If you select a subheading, your search will find articles that discuss the main term within the context of the subheading. For example, if we want to search treatment of breast neoplasms, we might select therapy or drug therapy as our subheading. That way we won't have to sort through results on breast cancer in the veterinary sciences or the diagnosis of breast cancer. the only results we have will be on the treatment of breast neoplasms. Earlier, we talked about the hierarchy or tree of the controlled vocabulary as a useful tool for finding terms that are more narrow or more broad than your search term. This tree can also be useful in clarifying your search results. In our current example, a search using the breast neoplasms controlled vocabulary term turned up a lot of results about male breast cancer, which isn't relevant to our research question. A quick glance at the controlled vocabulary hierarchy around breast neoplasms shows that male breast cancer is a branch below breast neoplasms. Some databases, such as PubMed, include the terms below the selected term automatically. This is known as automatic explosion. If we don't want to include one of these branches below our subject, like male breast cancer, then we should select the option to not include controlled vocabulary terms found below our current subject in the hierarchy. So now that we have a brief overview of why we use controlled vocabularies, we can apply them to our search strategies. Many of the databases you will use have controlled vocabularies, but they are referred to differently depending on the database. Ones that you might use in the future include PubMed, which calls controlled vocabulary terms medical subject headings, or MESH; Cochrane Library, which uses medical terms, or MESH; CINAHL, the Cumulative Index to the Nursing and Allied Health Literature, which calls its controlled vocabulary CINAHL headings; or some databases like PsycInfo or ERIC that just call their controlled vocabulary thesaurus. However, it's worth noting that not all databases have a controlled vocabulary. Some, like Web of Science, rely on keyword searches, so when you're running a search with multiple terms to represent one concept, you may need to try several different terms. And that concludes our presentation on controlled vocabularies. If you have any questions on controlled vocabularies in the databases at the University of Florida, don't hesitate to email or call the library or contact your liaison librarian directly. We would be happy to help you become a better searcher. You can also use our guide, UF Information Resources for Medical Students, to find this and other videos on literature searches and lots of other resources that are available through UF's Health Science Center libraries. Please stay tuned for Search Strategies, Part 3 of this Finding Evidence video series.